All right, we are live.
Okay. Hi guys, welcome back to another session of Fresh Dental Shadowing. Today we have Dr. Chen here, and I will give the floor to him.
All right. Sorry for the delay in joining on, but most importantly that we are here. Thank you for the introduction. I'm glad to have you spend some time with me today for the next couple of minutes. I guess minutes for a good number of time. So let's dive right into it. So thank you again. So a little bit about myself. How do I put this in?
There's a button that says present. Yeah.
Oh, there you go. So yeah, obviously it's I'm not used to Google Slides. I'm used to Microsoft PowerPoints. I give different kind of lectures all across the industry. So my name is Louis Chen. I was a graduate from NYU with a degree in economics, and I went to Columbia for dental school, which immediately after NYU, and I graduated in 2016, and I became a resident for 2 years somewhere in New York City, in the Bronx. I also served as a clinical instructor at Columbia while I was a resident from 2017 to 2020, in which I concluded my time. So again, right there. So a little bit about the schools I went to. I was admitted to NYU, Columbia, UPenn, Stony Brook, Rutgers. My location of choices were very limited to the East Coast, as I'm an East Coaster myself, born and bred in New York. But let's talk about some of the prerequisites that you would need to get to dental school. I was back in residency. I was also serving as the Columbia Admissions Committee member. So I kind of interviewed candidates and looked at their prerequisites and what we were looking for. So of course, the classic courses that you would need to take is the biology, the basic sciences, biochem, oracle physics, right? And then of course nowadays with a lot of schools are requiring students to take biochemistry, and of course you need the English and math. So by and large, the national average, the DAT, is around 18 to 19 out of 30. And a competitive score, when I say competitive, it's a good score that will score you an interview to, put yourself in front of applicant admissions committee members like myself to speak to about, your interests in dentistry and how you and why you would like to, pursue dentistry as a career. So a lot of people often ask me, what are your extracurriculars or what do you do? It is, for me, I'm a firm believer in passion. I'm a firm believer in doing what you sought out to do. I am one of the few people, when I say few, I'm not sure how many, but I'm one of the few people who pursued teaching a lot more, actually. I had a purpose in teaching, and I loved doing it. I loved giving back to the community. I had no interest in research because my research was not tangible to me as much as me having direct impact on other people. Like, for instance, today, as I'm sharing my experiences. So I ask people what their purpose is in life, and it's quite a difficult question to answer this early on in your career. But my personal purpose started when I was 15 years old, where I was spending, earning some money tutoring families, students of, families, and just kind of teaching them some of the nuances of SAT math, right? But as I started to get older, I started to realize there's so much more to teaching and just being a mentor that I became a better individual as a result. For instance, and one of the reasons why I love teaching is to uncover the roadblocks to prevent knowledge immersion. And what I mean by that is, what are the things that are preventing you from understanding this material? What is it that I can help you with that would make you more educated, right? There. To learn more about the way I deliver information in a clear, effective manner. So, sometimes you're in school, you're in classes, and sometimes the professors just drone on and on and on, and they drone about they teach information, or they present information in such a complicated manner. I'm more interested in just saying, here are the facts, here's the things. Let's make life easy. Let's tell you exactly how it is, so that students sometimes have these roadblocks that I want to uncover, right? And lastly, is for me to be more empathetic and be a better educator, and that's what makes me different. And the reason why I share these purposes is because when I was interviewing for dental school, a lot of the schools have asked me why I didn't do research and why I was pursuing more of the educational route. And these are the responses I've given in a more basic elementary way, because it was more exciting for me to understand to share information more, right? And then my interest, again, like I said, is not in research, and I quite frankly have no desire to be in research whatsoever. And at least it was honest, but at least it was also passionate and true, and not covered by fluff, right? It's not sugarcoated at all. So a little bit about dentistry. There are different specialties of dentistry. I've listed below is prosthodontics, which is full mouth reconstruction, rehabilitating compromised mouths. Orthodontics, braces as a very clear example. Endodontics, root canals. Periodontics, gum surgeons. Oral surgery, yank out teeth. Pediatrics, oral surgeons don't just yank out teeth. They also put in teeth, and they also fix jaws, and they do, facial reconstructions by doing big, massive surgeries in the operating room in hospitals, not just yank out teeth. Pediatrics deal with kids. Oral pathology, more pathology based, meaning looking at cells under a microscope, under diagnosing how the cellular patterns are growing, whether it's cancer, whether it's benign, whether it's malignant, all the above. And myself, it's not a specialty, but I'm a general dentist, and through my training at the residency, I was able to provide a broad range of treatments, such as full mouth reconstruction, surgeries, cosmetics, implants, sinus lifts, the whole 9 yards. And I've considered myself to be a comprehensive provider that can do most procedures that others would like to refer out. So let's talk about private practice. So as we are embarking this new venture in going to dentistry, there's more to dentistry than dentistry itself. So there's always obviously the business side, which people oftentimes ask about. And at the moment, for me, I am from New York. I am from Queens in particular, and I would like to stay in New York in the East Coast side. So I've been able to connect and meet with some great partners of mine who have a similar vision and goal of growth and expansion. So we were able to build a couple of offices and buy a couple of offices. So listed below is I have 4 locations in New Jersey, building our 5th office now. So Edgewater, Fort Lee, Hoboken, and we have another office in Union Square in New York City. We might potentially move forward in the next couple of weeks to build another one in Brooklyn, Williamsburg. And what are the deciding factors is where you want to be, right? It's part of it is actually, where do you want to see yourself staying long term? Is it family? Do you want a change of pace? What do you like about the area that you're in, or you grew up in, and where you're currently at? New York City is known to be the city that never sleeps, so therefore everyone's pacing back and forth on the streets. They have this immense desire to always be on and never turned off. That might be something you were interested in. There's a lot of influx of people from other cities that want to be in New York City, right? What do you want to achieve for yourself, right? Is another thing too. Is something. Oh, excuse me. I've got to sneeze. Excuse me. Oof. What do you want to achieve for yourself? Is that, do you want to be in New York City? Do you want to be in the East Coast? Do you want to have multiple practices? Excuse me. So the allergy season is really high here. What do you want to achieve for yourself? Do you want to build multiple practices? Do you want to have one practice? Do you want to work with your family, and so on and so forth? But most importantly, the question is, what is your why? Why do you do what you do? Why do you go to dentistry? Why are you interested in dentistry? And that's the biggest question that I like to ask a lot of the candidates is, dentistry isn't about the bread and butter stuff that I typically hear, which is, I've got work done on myself, and as a result of that, I want to go to dentistry and help others. And that's a great answer, but that's not enough to prove to me that this is what your calling is. And I think that's interesting, right? Because our perception of dentistry is really about what difference we can make through people's smiles, right? But dentistry is so much more than that. Dentistry is the opportunity to give patients the ability to create to build trust with patients. The mouth is a very intimate space where you want to respect, and people have this vulnerability as they are shy and they are ashamed to not have gone to the dentist for some period of time. So I found so much more joy using that as a challenge to see how I can make life a lot more open and for them to have a good time, so that they walk out happier than they walked in, right? So that's my personal why, and I strive to achieve that in my offices. So this or that, there's more than ever before, there is this growth in prior practice as well as corporate dentistry, right? There are some things that to just briefly talk about in both locations, both industries. And in prior practice, it's you own an office, but the pros is that there's no governing body other than yourself as a doctor. It gives you the flexibility to quote unquote do what you want. For instance, if you want to go fire someone, if you want to go hire someone, if you want to give people raises, if you don't want to give them, more HR, health, human resources work, you have that opportunity, right? There's no management team that you'd have to speak to, no CEOs, no, CFOs, so on and so forth, right? It's a decision that you make for what's best for the office and for the patients. Cons. Well, to do what you want sometimes takes a little bit of money. So that's less capital, which means that there's no money for you to scale. When we talk about the concept of scale, it means like, how do I take one location to 100 locations, right? How do I take one location to 2 locations to 3 locations to 10 locations? That's scale. It takes a lot of money. And of course, with that is a lot of stress as I navigate that with my partners. It's a little bit of stress as we see a lot of pressure on our shoulders. In corporate, let's talk to the other side. When corporate comes in, there's a lot of money that they have. They get a lot of money from banks, and the pros of that include, less administrative management headache. Sometimes you just want to come in, go back home, and just hang out and just watch some Netflix and just hang out with your family, your spouse, your boyfriend, girlfriend, whoever it may be. You just want to hang out with maybe friends. You don't have to worry about what will happen tomorrow because that's managed by the corporation. Stable income. You don't have to worry whether or not it's a good day or bad day. You'll get paid nonetheless. And you sometimes have benefits like health insurance, retirement plan, contributions, and so on and so forth. So there's a lot of pros that can come with being in corporate dentistry that others don't think about. But there are some cons to that too. There is more regulation by the management team. In other words, sometimes when you want to buy a certain item that's not necessarily frequently purchased, you would have to go to the chain of command to get that approval from management. And even for small things, there's more regulation there because, in the things that you buy, there comes a price tag associated with it. There's more stringency on profits because, you can't sit at home, sit at the office, twiddle your fingers and, expect to be paid a good check and do no dentistry. One of the things of you working in corporate is the requirement is do some dentistry, do a lot of it, and which might not necessarily equate to good dentistry. It might equate to because you were told to do it, right? So there's a lot less flexibility there to do, quote unquote, do what you want. And of course, sometimes in corporate, it is stressful because of that external pressure applied from the management team and the corporation to achieve more for the corporation. So this is my office in Hoboken. It's I purchased this practice. It's boutique. It's beautiful. You get to see, you can see there's a penthouse here. So you can see the exterior of New York City. This is my New York office, which is an Invisalign orthodontic studio. So it's a beautiful space. This is the back area, open bay concept, industrial look with pipes and bricks. This is our waiting area. There's no waiting room, quote unquote. It's like a lounge. It's a space where people relax. And there's plenty of opportunities in dentistry, right? So we talked about private practice. We talk about the things that you have to achieve in private practice. But being a dentist and being a provider is outstanding. It's given me the opportunity to, participate in outreach programs. I'll show you, this is a very memorable picture for me. And let's go from this area here. This image here was back in dental school when I think it's 2015 at the time. It was this little kid right here, fixed his tooth. Luckily, he broke into the mini fights, and you can see right here, I have this picture of him here on my phone, and that's him 2-3 years later. And this was him 2 years ago. So it's just so outstanding to see that the same person who I'd helped 4 or 5 years ago still remembers me from, look at this guy. He was up to my shoulder and now he's up to my hair. It's nuts to see that growth. And for the impact you have on these people are just so meaningful, that this kid, after so many years, rarely spoke a lick of English, now speaks to me in English, right? And this is in Dominican Republic, one of my favorite places to go to. None of the images here. This girl, super sweet. She loves chicken noodle soup apparently, and we would just hang out. We would dance around. We would talk. We would laugh, and she couldn't even communicate to me. But you know what? We communicated through laughter, through smiles, and you know what? A smiles can connect so many people, and it is so nice to be given the opportunity to be the person who will make an impact on a global scale. Right. And let's talk about some of the cases I've done. As much as you can go reach out to, other countries. I have plenty of friends who have gone to Vietnam, to the Philippines, to Dominican Republic, to Africa, and all the above. It's so nice that there's so much more need that's external to what we see today in the domestic arena. But some of the cases that we get to do, it could be very cosmetic. You can see right here, I got a little chipping there, and I made it nice and pretty. Same day, right? What about these cases here? Foam out reconstruction. Took me 1.5 years to reconstruct his smile from here to here. He's grew a little bit of hair on his mouth too, his surroundings. But being the person to change this guy, transform his smile from here to there is, it's a blessing, for them to come look at the smile after you've completed it and just say, wow, like you've changed my life. And, he can start dating again. And this is when I was in residency too. So, he was dating around, and he is a veteran, and he's just like, I just want to look good. Because we as providers can be the medium and a vehicle to induce great confidence and promote confidence in our patients, right? Even this guy here, it was in my private practice in Hoboken, and he had an engagement photo to attend to the next day, the next day. And he emailed my office at 10 o'clock at night, and I happened to be awake, which I am regularly at that time. And I emailed back and said, listen, I have an availability tomorrow. And he came in the next day. He got his tooth fixed, and he went straight to his wedding engagement and photo shoot and got some great pictures. And his family comes see me now. They drive 45 minutes to come see me. But it's just that impact, like people, the necessity to want to give back, to make sure that we're available to provide answers to these patients is one of the biggest things I love about dentistry, is that direct, tangible impact. Again, it translates from my lack of interest in research, which is not as tangible to me as impact in decisions like this or treatments like this, right? Here's another great example. Is not only do we do cosmetic work, and it's not about cosmetics, it's about enhancing quality of life, right? Making them feel good about themselves is key. And we could do that through our art, which is our dentistry. Now, a little about another case is not just cosmetics and doing veneers and crowns and whatnot. It's about this plan. It's about being better planners. And this is a guy who was referred to me by my friend, my colleague, who's an orthodontist, and he's trying to prepare his smile for his wedding, right? So here he is with a smile that he has. He has little buttons that are attached. These things are sticking out. They serve as little anchors to help move teeth. So Invisalign or clear aligners are these clear trays that are snapping onto your teeth, and they latch onto these little attachments that are on the surface of your teeth and create torque, pressure, movement gradually over time. So here's some close-up picture of it from the side. And he said, hey, I'm going to get married. I need some veneers to maintain the space. And so here we are. You can start to see that the teeth are moving gradually over time. Nothing has changed from the beginning to now other than creating space. So this is done by an orthodontist. And she sat there, she called me and said, hey, listen, he needs some temporaries. How are you going to do that? So I said, okay, let me figure something out. So this is how he looks now. Oh, well, back then, a lot of movements, a lot of spacing intentionally. Not he had teeth that are touching together, but now we intentionally want to expand his smile, and by expanding his smile, there are naturally going to be spacing between the teeth, to which we will fulfill. Up close to the image, and here we are. So he wanted veneers for 6 teeth. And I kind of removed it, polished the tooth down very minimally. These are called veneers. And the best way I can describe veneers is contact lens for your teeth. So they're very much thin, and they do not need aggressive work to be done on the teeth. A little bit of polishing on the surface of their teeth, removing the attachments that were there from here to here, and then making temporaries. So we were able to close a space, again, from here to here. It's a pretty nice improvement for a temporary solution for his wedding, right? And then he comes back and says, hey, I need new temporaries. Can you help me here? And I said, sure, let's take a look. And here we are. So the temporaries came off. He went back to see the orthodontist, to which she did more work. As you can see, even more spacing now persists, because again, this is part of the plan. This is a multidisciplinary, multiple angled approach that we would have to tackle. So we would have to continue to expand the smile in order to prepare some nice aesthetic veneers. Same thing here. So from here, he needed more temporaries, and we wanted to provide a potential outcome on his teeth. And here we are. So from here to here, again, I removed these little attachments that are on the surface of his teeth, and I made new temporaries. Pretty aesthetic for temporaries, right? It doesn't feel like they even look fake. And then here we are. Ultimately, this is the final preparation. When I say preparation, it means the final removal of tooth structure. And you can see most of the tooth structure is persistent, and they are the same. And I did minimal preparation, because the more conservative I am, the better off I will be. The higher success, and finish the case from beginning to end. Now, is this outcome what I would like the outcome to be? Absolutely not. I am not a personal fan of this outcome. I am more a personal fan of this outcome, because it is more in line with his facial profile. But he preferred to do his research, because he's investing all the time and money into it, that he would like to have something like this, to which he accepted. I was not a personal fan. My recommendation to him was still, I would have wanted something like this, where it was ovoid, like his face, and it's more aesthetic, it's longer, and it was manageable. But, again, it's not about what we say, it's about what they want. If they like it, that's all that matters. Right. But as you can see, the phasing, right? Like, we don't see the meat. People oftentimes get all this great work done, but we don't know how long it takes. It took him almost a year to get from here to here, by moving teeth, to going through temporaries, going to a wedding, to going on a honeymoon, getting more work to be done from here to here, temporary, comes back from wedding, final preparation, and final outcome. Again, from here to here, you can see this minimal reduction, minimal preparation. And of course, this is the final outcome, beginning to end. You can see that his teeth are brought up. His smile is wider. You can see it fills the corner of his mouth more. There's a fuller smile. You can see more of the lower teeth as well as a little bit of the top teeth, right? It's a nice full smile. But lastly, I want to end on a note because I would like to open the floor up to more conversation. It's all in the end, it's all worth it. In the end, the amount of time that you spend in school, the years, if we find purpose in what we do, there's so much work, there's so much value in why we do it. And hopefully that's a driving factor for you to achieve what you would like to achieve. And lastly, quality is not an act, it is a habit. And it takes a lot of time, a lot of effort to constantly and continuously do what you do in order to achieve what you like to achieve. So, any questions?
Okay, since we are currently on or just came off the topic of veneers, a current trend in social media, I'm not sure if you are on TikTok or not, a lot of teenagers are starting to get veneers because of their aesthetic and make their teeth look better. So, but young people getting veneers, even though it's not necessarily needed, can cause like health issues later in life, obviously. So how do you feel about that? What's your opinion on that? And as a dentist yourself, if you had a case of like a 15-year-old coming to you and asking you for veneers, would you agree to it or would you send her to somebody else?
It's a great question. First of all, I'm always super aware when someone asks me, I want veneers, because typically wanting the veneers is a choice. Pursuing veneers or having a dentist pursue it is a choice as well. I am focused my practice a lot on being preventive and conservative dentistry, which means doing less, getting more. And what by that, and to long story short, of the short answer to your question is no. I would say this is not what I would recommend, because don't forget, teeth, once they're tampered with, they would never be the same anymore. If I touch your teeth, I prepare your teeth, I make any adjustments to your teeth, it is always going to be adjusted for the rest of its life, to the entirety of your lifetime. If I reduce your teeth, as you can see the preparation, and to accommodate for, veneers, you will only remove more tooth structure as you get older. You replace veneers because you know what? You're in your 50 years old, 60 years old, your teeth are not going to look like they're when you're 21. You got to change it, replace it all. So there's so much more maintenance, so much more work to be done as a result of doing things early for aesthetic purposes. So I would refer it out, and prior to referring it out, what I would do is educate. My biggest thing is education. Like I spoke about earlier, is I want patients to make the best decision for themselves, which might mean I make less, then that's fine. I don't care, if going to dentistry is making money, then you're in the wrong field, right? It's a lot of work, it breaks your back, it's taxing, it's physically taxing, mentally taxing, socially taxing, all the above, but it's not necessarily, if you want to do it, by all means, go for it, but that's my personal preference. I would rather do a lot less and do more conservative treatment before I put any drills on your teeth.
Okay, another question with the cycle starting soon, I think, in end of May, beginning of June, and interviews coming up. Do you have any specific tips on how to stand out and how to ace your interview?
Yeah, so interestingly enough, I applied to a small handful of, schools, as I kind of showed you. And it was surprising to me that I actually myself got into 100% of the schools I applied to, meaning every school that interviewed me, I got accepted to. And I'm not saying that to, pat myself on the back. I'll tell you, in college, in my first freshman year in NYU, I had a 2.9 GPA. I got a C+ in biology for the whole year. C+, and I was not interested in biology. I was an economics major, didn't care about biology, hated the class, didn't like it. Maybe it was poorly taught, maybe it was me, right? But as I tried to reevaluate my study habits and the people I surrounded myself with, I was able to propel myself to adjust for the C+. I got an A in organic chemistry, I got A in chemistry, got A in physics, I got A in biochem. I excelled in other fields. Now, that's one sort of downfall. I got a 2.9, but that did not hinder me from, from performing and achieving well, doing well. Now, as you take your DAT, the DAT has a couple components. There's an English component, there's a math component, and of course, there's a sciences component, right? Now, with those components, I got a 30th percentile on English, and that's like, wow, like you speak, you can only read against, you're the 30th percentile of all the people who speak English. So meaning that you don't understand a damn lick of English, right? You can guess your way and still get that. So now, why do I say that? It's reading comprehension is probably one of the most looked at scores as you get the DAT, because they want to see whether or not you can comprehend what you're reviewing, which is really translates to the work that you the work that you'll be studying. Now, of course, a lot of schools have given me the opportunity to interview, and I was very selective with my process because it's expensive. It's to fly, to get hotels, I wanted to be local. I drove to all my interviews, and I remember Columbia almost denied me. And all I remember was Columbia was like, yeah, your English score is so low that I didn't know you could speak English. And I wasn't saying who said it to me. And I said, well, I'm in person. This is me. This is how I speak. Yeah. And they're like, that's a surprise. So let's get you an interview. And I got interviewed and I got in the next week. So it just shows you that taking initiative is so essential, and don't let grades justify, your candidacy. And you got to take a chance. And sometimes I took a chance because all I had to do was take a chance, right? So in order to prepare yourself, and the reason why I share that is that oftentimes people don't look at their experiences, their grades as opportunities of room for discussion. I used my C+, I used my scores to discuss why I achieved and how I grew from that. Now, the reason why I got my score for 30th percentile in English is because my dad drove me to the wrong testing location. I was late 1 hour, but I'm freaking out. And I was like, wow, like I thought I was going to lose time on my test, because they could technically cancel your test because you're late. Because you block out time to take a test for some period of time. If you overextend it, then they just can't take it, right? Because you reserve spots. So I was freaking out, sweating bullets. I was like, oh my God, I can't believe I'm doing it. I'm just doing my science. I did very well at it. But I explained myself. I said, listen, freshman year of college, I told straight out to the committee members that I worked 2 part-time jobs. I was tutoring, I was commuting to school, to NYU, I was saving some money, living with my parents, working while I was studying, going home late at night, commuting basically in total 3 hours a day, that it was giving me the opportunity to learn about time management, right? That it allowed me to do more with my time because I knew how to save time and spend my time wisely. So therefore, as you can see, my sophomore year to senior year, I excelled. I got a 3.9, 3.8, 3.9, and just ended the college career strong. And it translated, and you can see it through my passion. I used these downfalls as opportunities to discuss my growth, and that's more important than doing really well all the time.
Do you think that is what set you apart on paper?
No, it gives me the opportunity. No, did it set me apart? No, because what set me apart, I think, is actually my responses to the questions. When you know why you're doing what you're doing, there should be no reason why you should hesitate on any of the questions they're asking. If you know why you're going into dentistry and the passion behind it, if you try to memorize what you're trying to say, you're never going to say it the way you would like it to be said. But if it comes from within, like I basically told you, my passion for dentistry, it still remains the same. It's the same answer I said when I was in dental school, applying for dental school. It hasn't changed. But that's my purpose. That's what drives me to continue to do what I do.
What about for applications, so before interviews, do you think that set you apart on paper? That was my question.
Yeah, well, my dental school test score, the DAT, was good. I did well. It was we were it was on a higher percentile. My sciences did very well, and the only score that I did poorly in was just the English. And that's what sets you apart as a filter. Don't forget, tests like these are standardized for a reason. They're normalized to neutral, to kind of remove the factor that people are smart or went to a different college or whatever it is. Doesn't mean because you go to Harvard you get a great score. Doesn't mean if you go to community college you can't get a great score. It's a way to understand how you conceptualize and master the sciences and the testing, right? And some people can be great testers and some people can be poor testers, but still, it's a normalizing factor. So if you do well on your TAT, at the minimum, it's going to get you some sort of step into an application interview, and that which you have to conclude and do well in.
Okay. Another question. Why economics?
Why economics? Yeah, economics is I always liked it in high school. I just didn't want to study biology because it's not my favorite subject to learn. So I wanted to study something that I enjoyed, and then college was the best time to do it because do I know economics today? Not like I used to. Did I enjoy it? I thoroughly enjoyed it. I look back at it and I just say to myself, like, wow, I'm very happy I made that choice to be non-traditional. So you can see, here's put the pieces of the puzzle together. Economics major, non-traditional, did very well in the TAT. Wow. Right? And who got a C+ in biology and still did very well. Wow. Put those pieces together, I'm an impressive candidate, right? I was economics major who did better than bio majors. I did better with physics majors, biochem majors, whatever, and I still did better than them. Yes, maybe I got lucky. I had a great test day, maybe. But that's besides the point. All it takes is one shot. I did well at it, and it just made me stand out because, oh, wow, who's this guy who studied economics in the market and da-da-da-da, and you know what? Excelled and did just as good, if not better, than people who studied science for 4 years, right? That made me stand out as a non-traditional applicant. So why did I do it? I studied something that I wanted to learn, and that gives me the opportunity to learn other things and not stress out on microbiology, this biology, physics, this, neurophysiology. I don't want to study it. I'm not interested in it. That's not my forte. I appreciate that. If that's your thing, that's your thing. My thing is my thing. We'll keep it very separate.
So how is that transitioning into dental school where most of the curriculum is just heavily based on science?
Yeah, that's a great question. It's tough because, if you think about it, like I was one of the, not underperformers, but I was also undereducated, right? I didn't know as much biochem. I did not know microbiology. I did not know all the stuff that people had previous experiences and that put them on the upper hand, right? But, it's never good to compare yourself to your colleagues. And one thing I did is I never studied with my colleagues. Why? Because they're smarter than me. They were way better. They were way faster than me. They had better studying habits and tactics. I tried to study with them, didn't like it. They were super smart. They were way smarter. And I was like, wow. And they're like, I don't know how much stuff you can stuff in your brain, but my brain doesn't function like that. My brain functions elsewhere, like in different ways. And that's not to say just because you don't perform in dental school doesn't mean that you're not going to be successful. I was actually the top graduate at Columbia, and I was not the highest achiever academically speaking. I have no problem saying that because dentistry for me is more than academics. Just because one thing my mentor, my partner said is that just because you did well academically doesn't translate to external success, right? You can be great at school, perfect. But you know what? There's some smart people in school who are still the same where they are and they're comfortable. I'm on the opposite spectrum where I did fine. I did well. I was in the top 20 people in the school. Was in the top 10. Doesn't really matter to me. But one thing I did for sure was I went to dentistry with a passion, and I loved doing it. I was the first person to graduate at my school, and I kept doing it because why pay all this money to go to school just to kind of kick back on the beach and just and relax and be in the sun? I'd rather work my way to the very end of graduation and learn as much as I possibly can and keep doing it, right? So it did put me at a disadvantage, but it doesn't matter. Just because it was a disadvantage, everyone gets by. At Columbia, we were pass-fail, so all I need to do is pass. So I need to study just enough to pass. I'm never gonna look at someone's heart in the rest of my life. I'm never gonna touch the extremities ever in the rest of my life. I just need to learn the material, learn as much as I possibly can, perform well, and move on. And that was a marathon, right?
Was that a factor that you considered when deciding which dental school you wanted to go to? So
Yeah.
pass fail
Oh yeah,
decide.
sure. For sure. Yeah. Columbia was a pass fail system. It was fantastic. Yeah.
What were some other factors that compelled you to choose Columbia versus the other dental schools?
Well, camaraderie, we had a school of only 80 people per year. So we had, probably 1,300 people apply. 80 people would be, enrolled. It's a very selective program. And coming from a school, NYU, my chemistry class was 900 people. It's almost 1,000. My orgo class was like 500 people. My bio class was like 1,000. And, sometimes every day you just don't know who's even in the class. Sometimes it's different people. Like you can not even be taking the class to be in the class. They don't really care, right? It's just so many. There's no community there. So when I went to Columbia, I just saw the camaraderie that people love. They love being around with each other. They love spending time with each other. It is more a smaller community there that I wanted a change of pace. I was at NYU for 4 years. I almost went to NYU Dental, and I rescinded my offer, and I said, you know what, I'm just going to change schools and go to Columbia. And I probably one of the best decisions I've made in my life for myself.
Okay, we have some questions from the chat, and one of them was, what's your favorite procedure to perform?
That's a great question. I love to do cosmetic work these days. More not veneers, porcelain, but more like bondings, where there's more art involved in it. So you can create the texture of teeth, you can create the color of teeth, and all the above. There's so much more joy in that. I do love surgery as well, and one of my biggest joys is actually planning cases. I love planning cases. I love looking at an X-ray and say, hey, I can tell the history of this patient. The other day, I closed 2 full mouth construction cases, and then I looked at the case, and I just enjoyed learning about the alternatives to treatment, because there's never one right answer, and there's never one right way. There's so many different ways that's catered to the patient, that's specific to them. Maybe they don't want surgery. Maybe they do want surgery. Maybe they want to do a little bit of surgery. And how do you devise a plan that would achieve a similar outcome and approach it in different ways? And I find that so much more intriguing to me, because you're critically analyzing the patient. You're critically thinking about alternative solutions versus, hey, you got a tooth that's broken, get a crown. You get this, you get that. It's never linear for me, and I don't like that linearity in dentistry.
Awesome. Another question was, what is something you wish you knew that would have made your dental school experience better?
Don't work too hard. Ever since I was in college and 15 years old, I been working, and one thing that you can ask my friends, they always tell me, go on vacation. The last vacation I took was 2016, which is 5 years ago, and I haven't been on a vacation since. It is, as much as it is, running to the end, sprinting as much as you can, as fast as you can, sustainably. Sometimes it's important to take a break and stop and walk a little bit. And my suggestion moving forward is, if you need to take that break to walk. If you're going to sprint.
Okay, so you are relatively new to working in the office, if I'm not wrong, since you did a residency for 2 years, right? Did the pandemic slow anything down, considering you were a new dentist, and what were some things you had to change? And
great question. Yes, although I finished dental school in 2016, I had been working as soon as I got out of dental school for around 4 to 5 years already. Because when I was residency, I was working for another doctor in New Jersey. So I've been in private practice for a couple of years, and as a result of that growth over the years, I've been able to manage and own around 5 offices. So I've actually stepped out of clinical dentistry a lot more. So I practice 2 times a week now instead, and I'm trying to phase out by this year. We'll be no longer practicing this year, hopefully. Not because I don't want to, but because there's way to achieve a dream, to pursue a dream and achieve that vision, you do have to sacrifice what you love, which is sometimes the clinical aspect, right? How has COVID affected that? COVID has affected a lot of things, right? It had me remove myself a lot more so I can focus on that growth, because COVID is a pandemic and we're in the pandemic, and it does affect a lot of things, whether it's you're still disinfecting time, whether it's the amount of patients that you see, whether it's the people that we engage with, whether the separate protocols in which someone tests positive, and all above, and all the grants are being put out there, and I have partners that I work with, thankfully, and I would not be able to achieve what I am without the people that I know. Now, has COVID affected a lot? It has affected a lot of people. It has negatively affected others by, offices are unable to, maintain patient influx, cannot sustain the growth, and they had to close. And fortunately, my partners and I, we've been actually growing. We're growing the fastest we've ever grown as a result of COVID, because we stayed open when others closed. We were available for emergencies. We were sacrificing, put ourselves in the front line when others were closed. So we stayed open. We were available for patients who were in pain, and we kept up. And luckily, we were very, very lucky that we kept up.
Did you guys have a COVID outbreak in your office at all during that time?
Nope, no COVID outbreaks. So some of our team members had gotten COVID as a result, not necessarily as a result of being in the office, but due external measures. We've got our own protocols in place as per the ADA. Thankfully, all our team members are vaccinated right now. It hasn't affected much, but we do take the precaution because it is a real thing. It's here to stay. It's not here to go. We still want to make sure that people are being respected, whether it's those at home, whether it's with your friends, whoever who have not been exposed, gotten the vaccine. So it's pure respect at that point.
Okay, another question from the chat was, what do you think is the most difficult part of opening up your own practice?
People. Dealing with people is hard. Dealing with people, making people inspired, dealing with their concerns, pay, money, vacation, this and that, drama, all of the above is the biggest headache that one could ever possibly have. And we like to, unfortunately, I don't like to deal with that too much, but that's all I do now.
Okay, would you say residency is harder than dental school?
I would say residency was an extension to dental school, which gave me the opportunity to learn what, the things that was supplemental to my education, to do more that I learned, that we were taught, but never saw and did in dental school. So if anything, it's been giving me the opportunity to do a lot more. And I always highly recommend it.
Another question was, how difficult is it to find a job after dental school? Is the specialty harder or easier?
That's going to be determined after everyone leaves dental school, because the dental industry is shifting so drastically and so fast that there's really not an ability to kind of pinpoint exactly where the industry is going, unfortunately. But we hope that is it easy? I think that if you find the right people to be associated with, it will be easy. But the question is matter of where if is it going to be a difference in insurances? Is it medical going to be involved, so on and so forth.
Another question was, what are the years broken down to D1 versus D4?
All right, so that's a good question. So it seems like there are a lot of seniors in here. So D1 is more basic sciences, meaning taking the necessary courses, anatomy, physiology, biology, microbiology, biochem, blah, 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 all that stuff. At least at Columbia, we were taking classes with medical students. There are a few select schools that do share classes with medical students. Columbia being one of them. We spent 1.5 years with them, so we learn medicine with medical students. At the same time, we do learn a little bit of dentistry and do dentistry. So it's a concomitant double whammy kind of thing, right? Now, we are slightly different because we perform on cadavers. So we don't learn plastinets where we have a plastic body and learn the anatomy, but we actually do dissection. We dissect the body. We look at anatomy. We slice the head. We do all this stuff. So Columbia was one of the schools that allows for that. And then after that, you take your boards in your second year, which is the licensing exam, and then you move forward in your clinical stuff. I actually have an interview to attend to. So if there are other questions that someone needs to ask me, then you can email me or whatever it is that you guys how to communicate with me. Does that work at all?
Yes, no, you're totally fine. You're good to go. That's fine.
I have an interview at 7:30 here, and then she showed up, so I have to attend to that.
No, that's totally fine. His Instagram is dr.louis.chen, and then you can just shoot him a DM if you have any more questions. And thank you so much for hosting a session with us and taking time off your day. And yeah, you're good to go to your interview.
All right, thanks for the time and your attention to all these amazing questions. And I'm here to help. I'm here to help give you a hand, no matter what. I'm an extension of all of again, trying to help as many people as I can because I want you all to be successful. And I know that some of you are looking for some sort of solution and answers. And again, plenty of opportunities out there, plenty of resources out there. So I thank you for the introduction. And if there are any questions that you may all have, feel free to reach out.
Thank you so much.